Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Surprising was the question of the day. Are you on Ozempic? The GLP-1 drugs have become so notorious that uh, that's the question of the day. Are you on Ozempic? And how do you answer somebody who asks you that question? Or do you answer that? And the fact that they would actually have a large section on that tells you a lot about the revolutionary aspect of the GLP-1 drugs that are just really beginning to make their impact, although still is only paid for treatment of diabetes. It's still not the insurance is for most parts not still not paying for the management of obesity by the GLP-1 drugs, although as we've talked many times, there's so many different benefits of the GLP-1 drugs that their impact is just beginning to to be manifest. Any comments or question about that subject?
The doctor put me on Ozempic. What's the day? Thursday. I think it was Tuesday. Um, because of the diabetes reading that I had after the fall. My diabetes had gone up higher than it ever has gone up in my life, and that was something like 535, whatever, uh, for my diabetes. So he put me on that. We're gonna see how it works. I've only had 2 or 3 days of it.
You take it by injection, right?
No, he didn't say that.
How do you take it?
I'm taking by pill.
Oh, great. Okay. Because initially they had most of the GLP-1s were by injection, and of late they are now getting the pills and even nasal uh, uh, injections. Okay, well, let's see. What do you think about that question? Is that a personal question? Is that something that you should ask, or is it anybody's business but yours? What are your thoughts?
I don't think anybody should know what I'm taking except my
Except you
doctor.
and your doctor.
Right.
Doctor is.
Yeah.
Hmm. Any other thoughts or comments about that?
Mm-mm.
I don't know. I'm kind of open to discussing drugs because, you can learn so much.
Yeah, it's true. Especially drugs like this, which have expanded far beyond most people's fondest dreams.
Yeah.
Yeah.
Yeah, well, I just told you all this morning, so you know, I don't mind, because you're gonna be asking me how is it doing later on, and I'm gonna tell you.
Yeah, okay.
Well, with me, knock on wood, my drugs are minimal. Um, I had the doctor's appointment this week. I have asthma and my sarcoidosis is still hanging in there. So I had to go for some chest x-rays this week. But I'm good.
Yeah, okay.
Yeah.
Okay, all right. I guess Buchanan, we can start the articles. We have a plethora of them as usual. This is an interesting article as we talk about xenotransplants, and this is the first pig lung transplant. What will come of it, we shall see. So far, most of all but one of the xenotransplants that have been done before have had to be removed or the patients have died. So this is something that is going to be this year and next year are going to be the time in which the xenotransplants will be done on a countrywide scale. But this is the first of a pig lung. Uh, well, the consequence of it, time will tell. Uh, I think that this is an idea whose time has come, and this is the first for the lung. But so we shall see. The lung is probably the transplant that is least successful so far in terms of the allo transplants from human to human. But whether this would be successful in man with the pig as the donor source, time will tell. Any thoughts or comments?
Dr. Callender, does the pig transplant, is it related to the times when they used to use a pig for dialysis? Is that related in any way?
And probably not. That's related to the fact that pigs have been used for centuries for different things. You know, we use it for the heart valves and a lot of the initial insulin came from pigs. So that there's a long history. Of course, I think the greatest motivation was when the HIV came from the primate model, which was the model that was thought to be the model that was going to be used. But because of HIV coming from the primate model, they got away from that and decided to go into the pig. And since then, most of the experimentation has been using the pigs.
Thank you.
Any other questions? If not, lung xenotransplantation is the most recent. Started with the heart and kidney, and now the lung. And this was done in China, by the way, so not here in the United States. This is an interesting article that is disturbing in many ways because the Supreme Court is supporting the Trump administration cutting research funds, and that's not so good. But anyway, that's the Supreme Court we have, which has got a long history of making bad decisions. So just another one. Any other comments on there's actually this is a small part of the 12 billion that have been cut. So this is just beginning of what may be a very painful cut back on research in the United States.
You. Yeah.
I'm not on it.
I got a question for you.
You know, Dr. Callender, my thought is, what's the motivating factor behind all these cuts? Why are they doing it?
Oh, well, the Republicans have a plan over the next 4 years to uh, save money and make America white again. I think that's the plan. But in that plan is uh, taking money from the poor and giving it to the rich. That's a major part of it. if you're really interested, you're looking at the Republican plan for the next 4 years, and it's all about saving money on the backs of the poor and getting the rich get richer and the poor get poorer.
But it to me it's counterintuitive because health is not just for Black people, it's for everybody.
Well, also Kennedy and Trump have different ideas about health. They believe that we're doing things the wrong way, and they're trying to do it the right way. That's their perspective, that what they're doing is the right way.
What are they doing?
They're cutting money from all research grants that have anything to do with DEI, and uh, they're trying to uh, get away from all of the things that have been taught to be done appropriately, because they feel that America has been going in the wrong direction, and they are therefore trying to reverse just about everything. And in the road to hell is paved with good intentions. They have good intentions. They they just are have a different way of looking at it. And they think what they're doing is going to right America.
But to me, it's totally illogical. Would you know? How can you make America healthy if you're cutting the scientific research in health?
Well, they're saying that you're researching the wrong subjects, and uh, Kennedy's feeling is that most of the research and other things we're doing is fundamentally wrong, and what he's doing is fundamentally right. And the Supreme Court is backing him. So what can you say? Any other thoughts or comments about what's just beginning to happen? This is just the first 8 months. We got another 3.5 years to go. So it's going to get much worse or much better. Depends upon how you look at it.
And that's scary. He's done a lot these few months, and we have 3.5 years to go.
Yeah, it's kind of sad.
Yeah.
Well, one way to look at it is that he's got until the midterm elections in 2026, because if there's a Democratic Congress next year, they could rein in a lot of these changes that are being made.
We hope.
That's the only hope. You're right. That's the only hope. But of course, that would require the Democratic Party to demonstrate that they can oppose these things successfully. But you're right, with the Republican House and Senate and President, uh, that's the only hope.
Right.
Yeah. Have we no shame? Answer, no. Okay. Yeah, see, this is what the Trump administration, they believe they're doing the right thing, just like Hitler believed he was doing the right thing and killing all the Jews. That doesn't make it the right thing, but it shows that the road to hell is paved with good intention. People mean well, but that doesn't mean that they're going to do well.
Yeah, there's still a very strong anti-vax community that's um, that solidifies their position all the time on social media. So they're gaining more followers, and their big thing is they think that vaccinations cause autism in children.
Well,
Well,
there's no
they blame,
data to
yeah,
support that.
And they blame a whole host of medical conditions on vaccinations. They'll say that's the reason why heart disease is increasing. If you take a vaccination, if you're a middle-aged man, you're more likely to have a heart attack. Yeah, it's just, but at the same time, like uh, measles outbreaks and polio, that's increasing. Pertussis, uh, but they're trying to cover up the details, and so people aren't aware of the increased incidences of diseases that used to be wiped out because of vaccinations.
Any other comments? Yeah.
Yeah, I had an encounter with a guy who's actually doing some work for me, and I don't know how we got on the subject. I was getting ready to ask him why he was coughing and sweating, and he was on the phone with his father, and he was telling his father, um, his father was sick, and he was telling his father, you need to go out and get this homeopathic cure for it. It's going to be all right. He needs to drink carbonated water, uh, pH balance. Uh, I mean, he had a whole list of things, everything except a vaccination. He was telling his father, do not get the vaccination. He was not going to get a vaccination, and he was black. Um, so and he was powerful with it. Um, so there, and I don't know. It's the first time I've actually come face to face with the opposition, but there is a group of people who think that way and are I don't know if it's violent, but it's definitely an energetic effort in that direction to not be vaccinated.
Okay, that's any other comment?
Yeah, not only that, but in right-wing talk media, this is very anti-pharmaceutical bias. They think that the pharmaceutical companies are evil, that they produce drugs that don't actually cure anything. They don't think that there have been any cures through drugs.
Okay, any other comment? If not, we'll go to the next article. This, this is the CDC uh, justifying why they have eliminated medical organizations from their work groups because they feel that they are biased and they're pushing their agendas forward, which is not in the best interest of the American population and their health. So that's the why they are eliminating these groups from the CDC. And so they think they're doing the right thing. Yeah, yeah. So, and they're moving forward strongly to, uh, in spite, of course, as far as I'm concerned, the Congress of the United States is at fault, along with the Supreme Court. So, because they knew what Kennedy stood for when they approved his appointment. So it's not a surprise. None of this is a surprise. Okay, let's go to the next one.
I have a quick question though. If if the pharmaceutical companies are being eliminated from the committee, is anybody taking their place, or is that just um,
Well,
uh,
it's not just pharmaceutical, it's medical groups along with pharmaceuticals. And yes, they're putting people in their place who have the opposite feeling about it. They agree that vaccinations are problematic, and they agree that the way that the health system is going is wrong. And so they're trying to make it right. That's that's what they feel. So that's not just the pharmacy, it's anti-medicine. So,
hmm, okay?
So, question, is big pharma increasing?
their intent is to get big pharma to decrease. That's their intent. This is an interesting article on new guidelines for management of hypertension. And since more than 50% of Americans have hypertension, these new guidelines are to replace those that existed in 2017. And the difference is that they're shooting for a pressure of 130 over 80. And if it's higher than that, it just needs to be treated by initially by healthy diet and lifestyle changes. But if that doesn't help, then they need to be on medications. And the medication should keep the blood pressure below 130 over 80 and preferably lower than 120 over 80. And they emphasize dietary changes, lifestyle changes, as you see here, fruit, vegetables, uh, poultry, beans, nuts, etc. And so this then is something that is the current status. Yeah, it seems like every 5 years it changes. So this is the most recent change. They also are advised that you have under 2,300 milligrams of sodium every day. Uh, uh, although they like it to be at 1,500, but a little low for soda. So preeclampsia is something that hypertension during pregnancy is something that is a forerunner of hypertension for the rest of your life. So they're talking about giving a low dose aspirin to prevent hypertension during pregnancy. So, any comments about this? This is kind of what your doctor will be using for the next few years. Some would take issue with the recommendations about alcohol, but uh, there's still a lot of controversy about that. Some say no alcohol is the best amount, and as you read, some say 1 to 2 drinks a day is okay. And this article is adding ways to hit height ratio and comorbidities in terms of looking at the significance of being overweight. Uh, and they're saying BMI alone is not the whole answer, but waist to hip is also important. And they are emphasizing, as we are all aware, the importance of healthy lifestyles and healthy diets. but they think that BMI alone is not sufficient. And that's why they emphasize the waist circumference. And not only waist to hip, waist to height. Any other comments? As hypertension, as we talked last week, that uh, heart attacks are decreasing, but hypertensive heart disease is still increasing as a cause of death. Hypertension and diabetes are two critical risk factors. So keeping the BMI around 6 or under, and keeping the blood pressure under control, under 130 over 80, becomes critical. No comment? If not,
I've never heard of a doctor doing a waist to height measurement,
well, I used to do waist to hip.
a waist to hip.
Yeah, but waist to height is a new modification.
But I'm saying I've never heard a doctor do that.
I don't know why it's common now, but you've made a comment that you didn't know about a doctor doing it. But there's been that discussion about it for quite some time now. But your comment is still true that a lot of doctors don't. They think the BMI is the end all, but there's a lot of discussion about whether the waist to hip or waist to height circumference is just as meaningful.
So
I just
how is that calculated though? They measure the waist, they measure the hip.
Yeah. Well, the waist to hip means that you measure both the waist and the butt. The weight to height, you just know what the height is, and you also know what the waist is, circumference is, and you try to keep them at 0.5, greater than 0.5. But uh, as you mentioned, not a whole lot of doctors have bought into that.
So there's a formula.
Yeah, long been a
yeah
formula.
You know what the formula is? Darryl, you
yeah
got the
it's
formula
just
over
as simple. It's just
Yeah,
as simple as you can do it by inches. Your
yeah.
waist divided by your height. And so if you're 6 foot tall, that's 72 inches, which means that your waist, ideally for a healthy waist, should be half of your height. And so if you're 6 foot tall, 72 inches, a healthy waist is 36 inches or less. And it's avoiding the big belly thing. You got a big belly, you got a big waist, you got more likelihood of a heart attack, cardiac disease.
Is it the same for waist to
Yeah, waist to hip, same thing.
so it's waist divided by hip?
Yeah. hmm the only difference is that the big butts are healthier than big bellies.
Yeah, there's calculators that you can get on the internet for waist to height or waist to hip. So you can see where you fall, different ranges like extremely slim, slim, healthy, overweight, very overweight, and obese.
Okay, thanks.
Okay, let's go to the next article then. This is a interesting article talking about the myths that dietitians have taken issue with, and it's a very interesting 6 items that they have addressed over time, and cutting out eggs was one of the myths that eating eggs was not healthy, and that of course apparently is something that they do not cater to anymore because they feel cholesterol. I mean, eggs are good and do not raise your cholesterol. And they say that it's the saturated fats and trans fats that are really the problem. And dietary changes can fix high cholesterol, and most people would argue that sleep, stress levels, exercise, and genetics play more of a role than dietary changes, but it's okay to start with that. But more often than not, dietary changes alone uh, do not eliminate the need for medication for uh, high cholesterol levels, which denote arteriosclerosis and damage to your heart, brain, and kidneys. All dietary fats do not need to be cut out. They point out time and time again that it's the saturated fat and the trans fats that uh, are bad for you. The unsaturated fats are healthy. And it's just like you, HDL is the higher it is, the better. And the lower the LDL is, the better. And then myth number 4 is that you can tell if you have high cholesterol by your symptoms, because uh, high cholesterol is like hypertension, no symptoms. And number 5, you can only have high cholesterol at a high body weight, which is absurd. Some of the people with the highest cholesterol levels are thin people. And the sixth one, so what the sixth one is, you don't need to worry about cholesterol until you're older. Darryl?
Yeah, and I think, like you mentioned, cholesterol can be a physiological response to stress because that produces stress hormones like cortisol and adrenaline, and that can trigger changes in your metabolism, raising your LDL or the bad cholesterol. So, things like meditation and getting enough sleep, as well as good diet and exercise, can reduce your overall stress and your cholesterol.
Thank you for sharing. This is I mean, these are the other common limit sugars, fill up on fiber, limit alcohol, and exercise, as you were mentioning. Healthy lifestyles and diet make a big difference. But without those other factors, uh, you still need help. Actually, it's more common than you think, but you will never know unless you get your cholesterol levels drawn. So, and everybody should know the cholesterol level, like you should know your hemoglobin, A1C, and your blood pressure. Any other comments on this? If not, we'll go to the next article. Ultra-processed foods. We've seen so many articles on ultra-processed foods that everybody says bad for weight loss. And yes, that's correct. And they are associated with increased weight loss. And most of the uh, dietitians would agree that the biggest culprit in obesity is ultra-processed foods. And most of the evidence suggests that minimally processed foods is associated with better health. So there's not really much of an argument that ultra-processed foods is unhealthy. The question is, where do you find them? And it's something that we've discussed before. And are all ultra-processed foods unhealthy? Some are, some aren't, but the balance of the minimally processed foods is what makes the difference. For chronic diseases, it's clear that these sugar sweetened beverages, which some of us may love, and processed foods associated with increased cardiovascular disease and coronary artery disease. The data is tough to argue against. Any thoughts or questions about oven processed foods and soon too much fast foods, too many sugary beverages, too many cakes, donuts, and chips? Why talk about all the foods that taste so good, huh? And they need to be replaced by legumes, fruits, and vegetables. And that's in many ways what the Kennedy administration believes. So spending more time working on the ultra processed foods uh, actually makes a lot more sense than uh, eliminating vaccinations, but they believe in both. So we shall see. Any comments? Betty Blair?
Yes, good morning, everybody.
Good.
I'll stick with my not eating after 4 o'clock because that way I can eat what I want to eat. Mm. So far, so good.
If it works, fine.
It's working.
Any other comments? Okay, let's go to the next article. Chronic low back pain, which is common, they're suggesting that cognitive therapy will actually offer sustained relief for chronic low back pain. Chronic low back pain is something that is thought to be very common. I don't know how many of you out there have it, but it certainly can get in the way of standing and sitting. Okay. The physical therapist and the psychologist all believe that the cognitive therapy will help eliminate it. Of course, that along with other pain medicine has been evaluated and it has shown that it has given sustained relief.
So, Dr. Callender, what is that cognitive
Uh,
therapy?
that's a treatment by uh, psychologists to have you come in and talk to them and tell them about your problems. And this is now demonstrated that this has been effective in addition to the other treatments and giving you sustained relief to low back pain.
Does that have anything to do with sciatica?
No, because sciatica is a specific cause of back pain that is usually related to a disc. And uh, but if your question is, can cognitive behavioral therapy help sciatica? It's possible, although if it's really related to a disc, uh, you could try that first, and then if that doesn't work, you can then uh, try the other methods. Of course, if it's really related to a disc, then this surgery may well be the treatment. But you could try cognitive behavioral therapy first before you go to the surgery. And the data is supporting the fact that this cognitive therapy is effective. It gives you sustained relief, so it's worth a try.
Okay.
Okay, next article, please. This I included because I don't know how many of us actually use the botulinum toxin, which to look younger, but certainly people who are not of color use a lot of these toxins, and when they get the injections to decrease the frown lines, it's effective at losing about 10 years. And so I don't know how many people of color are involved with this, but certainly uh, people who are not of color, uh, they live by botulinum toxins and they get their, you see the data here, 4.9% were black, 4.2% Asian, but almost 83.9% were white. So that we tend not to do the toxins, but that's very popular in the United States, particularly among the white population, the white female population. John Buchanan?
Yeah, I thought a toxin is a bad thing.
Well, it's a good thing for your frowns, for the wrinkles on your face. It relaxes some of those wrinkles and makes you look younger. And much of the cosmetic work on the face involves the toxins.
And I thought botulism was a deadly disease.
It is, but, but it's interesting how,
Doesn't seem to make sense to me.
yeah, but you see how many people are doing it in the white population. So that's why I included it because I know it's something that white folks do all the time, and if black folks are doing it, it's not a whole lot of them, and if so, they're not talking about it. So, what do you think? Do you think many uh, black folks are getting the toxins?
I do not.
Darryl, you got a comment?
Well, they say black don't crack, and that's pretty much true. But yellow does. So for some of us light-skinned blacks, like the Whitley character in A Different World, I've seen interviews, recent interviews with her, and she's now a senior lady, and she could benefit from Botox.
Okay. Thank you for sharing. Okay, let's go to the next article then. This is in France, this is an issue. You know, it's amazing the things that occur on social media. And one of the things was getting a sunburn tattoo, uh, which of course would increase the number of skin cancer in people who are white. And so this in France caused them to really put out a lot of advertisements to get them to stop that practice because it would lead to cancer of the skin. But on social media, they had suggested that getting a sunburn tattoo was something to do. But of course, the sun and its ultraviolet rays are very damaging to the skin. So exposing yourself without sun cream is just dangerous, period. So 85% of skin cancers are linked to sun exposure. Childhood sun exposure, that.
I want to put in a play for suntan protection for Black people, because we do get skin cancer as well, and sunburn. I've had sunburn before, so we may not need it as much as white people do, but we do burn.
Thank you for sharing, 'cause it's so true. Any other comments? Your skin is your life. You only have one. Don't sacrifice it for a 30-second buzz.
It's also your biggest organ, right?
Absolutely. Biggest organ. Yeah. Such a source of protection. Yeah. Okay, let's go to the next article then. This is a concerning trend that cosmetic retailers are targeting tweens and pre-adolescents because they may not know any better and realize that in these products are substances that are dangerous, particularly with fragrances. And we talk about phthalates and organic compounds that dangerous to the skin and also for pregnancies as well. Now, this is an interesting notation. European Union bans 1,300 chemicals and cosmetics. Canada 573. United States only 11. So you can see that the skin applications, if they're not since they're not even banned in the United States, can be very dangerous. Any comments? I don't know about our use of these things, but Darryl, you had a comment on it?
Yeah, well, it seems to me that if cosmetics are dangerous for kids, that they're dangerous for adults too.
Absolutely. Seems they are more dangerous for kids.
I wanted to comment that the exfoliants have a lot of those microplastics in them.
Right. And once you get them, you can't get rid of them easily. But they're targeting the tweens and the pre-adolescents because they know that on social media that they play those things up and they don't know any better. Okay, let's go to the next article then. And this is just more appreciation so that your children and grandchildren and great-grandchildren can be alerted to the fact that in the beauty aisles and you're trying to look beautiful, there are endocrine disruptors that are anti-health factors, and they promote these conditions. Bisphenols are the commonest. Now,
Yeah, petroleum products. That's in a lot of cosmetics and shave cream, and that's an endocrine disruptor. Um, so, for all of you that like a smooth shave, you're putting your body's absorbing a lot of the petroleum products that are in your shave creams.
What do you use for shaving? What do you recommend?
Not shaving. Like women shave their underarms, their legs, men shave their faces. That's not the way God built us. He built us to have hair everywhere.
Interesting soaps, deodorants, and toothpaste. Should we use deodorants? That's an interesting question that we have different opinions on that. The pregnant women and babies are particularly vulnerable.
What does endocrine disruption actually mean? What does that do?
That means that you have hormones in your body, and these chemicals uh, negate the positive effects of the estrogen, the progesterone, and the testosterone. Those are, and then of course the adrenal gland, uh, flight, and all of your responses are all based upon your hormones that are produced, so that these substances uh, work against the protective aspects of the hormones that your body's produced to keep you from harm. So
This
they call them endocrine disruptors.
this is one that I have been talking about the effect of the sunscreens, especially the some of the chemicals, the benzene related um, kill coral. All right, and coral is the basis of the aquatic marine environment. You know, the coral feeds tiny fish, and the medium-sized fish eat the tiny fish, and the bigger fish eat the medium-sized fish, and we eat the big fish. And without those coral reefs, we won't have any fish.
Mm.
So they recommend, not when you get sunscreen or protection, when you go out, make sure that they're reef safe. Thanks.
Darryl, you had a comment?
Yeah, well, okay. Back to the comment about should we wear deodorant? When we smell people less, we have a less developed sense of smell, which historically is very important because I'm reading, okay, I knew this, I didn't have to pull it up off the internet, but it says, yes, humans can smell close relatives, and studies show they can often distinguish them from non relatives through their body odor. This ability is likely an evolutionary adaptation to facilitate kin recognition and avoid inbreeding. While mothers and their infants often form strong olfactory bonds, children can also identify siblings, and parents can identify their biological children. So, all of
Mm.
these abilities that come from smell, we destroy all that with deodorant. Oh, okay. Inbreeding. There's pheromones. That's a very strong hormonal reaction. Um, so, uh, if you don't use deodorant, not that you're sending off dirty smells, but you're sending off smells that I'm a man, I'm a woman, uh, and it's a very strong sexual um, uh, promoter, for lack of a better word. And so, with your natural body odor, you are sexier. You're sending off stronger pheromones that are that other people can sexually respond to, and you avoid inbreeding if you can smell your close relatives.
How many people do you think really pay attention to that?
Nobody.
I have a
See, I'm
question.
I'm an old soul, and I study all the ancient ways. A lot of our ancient ways were actually better for us than our modern ways because we've only been doing deodorant since the early 1900s. It was never done before. The only thing they did was in the historically is they added perfumes, but not deodorant.
Hmm. Uh, Somebody else had a hand up?
Yeah, I had a question. I'm just going to put this out there. Um, Africans don't don't believe in deodorant, right? Is that true?
Well, uh, that is something that was promoted. And as people who came from Africa, recent Africans, uh, were noted for the fact that they did not use deodorant. Whether that's an observation that many made. Whether that's true or not, I'm not aware of, but I know that was the experience. Betty Blaylock first, and then Darryl Armistead.
Yes. Um, I'm not quite as old school as Darryl, but um, I am one who don't use a lot of cosmetics. I never have. And I recently went to my doctor for my checkup. And when I went to the counter, the lady looked up at me and said, what? I looked at and I couldn't believe that you were the person that's supposed to be here because I guess she was looking at my age. And she asked me, what do you do to look so young? And I thought for a minute about the things that I really do that probably normal people don't do. And one thing I told her, and I looked at her, she was made up with makeup. But the one thing I told her is I've never used makeup. I've never used any type of makeup. I wash my face with basically water, sometimes soap, but I just don't use a whole lot of cosmetics. I do use deodorant at times, not always, because if I'm not going out or whatever, I don't really put deodorant on or anything else. But it struck me that she looked at me and thought I was younger looking than my age. But I told her that's the only thing I could think of that I have always done from childhood. I've never used cosmetics.
That's
Rarely,
Mhm.
rarely do I even use perfumes. I just, you know, so
Thanks for sharing. Thanks for sharing. Darryl, you had a comment?
Yeah, the internet says yes, people across Africa use deodorant, but there's a mix. You got in the more urban areas, they're more likely to use. Among the younger people and in urban areas, they're more likely to use deodorants, particularly in hot tropical climates like Cameroon and Nigeria. The use of deodorants to combat sweating is common.
Hmm.
Any other comments? If not, we'll move to the next.
Yeah, real quick. This is Charles Davis. And Dr. Callender, I know I read where you spent some time in Africa, but did you do in some of the other outlying areas, not the major cities as such? Now, in travel, going to some of those, and I don't know if anybody's experienced when, you leave there and you get back, say, to places, let's say to Rome or somewhere. But the flight attendants would take aerosols and just start airing, going up and down the aisles with the plane, when you get there. And I don't know if anybody's experienced that, but in some of that, but I don't want to go race with it, but yeah, when the plane is landed, from coming out of Africa, that's what they've done. Yeah. So what for what it's worth about the deodorant and what have you. But yeah, that's something I noticed.
I know my experience in Africa was that, and it didn't seem as though the Europeans used deodorant, but
Hmm.
the native Africans did not.
Yeah.
Nor did I when I was there. So,
Mhm.
any more comments about this subject? Okay, let's go to the next article. This is a condition that many of you may not be aware of, hidradenitis suppurativa, which as a surgeon, I hated more than any other condition because people suffered so much from actually using deodorants and getting infected armpits. And
Oh,
this was a cause for many abscesses and required surgical intervention. And it's interesting that these patients require many surgeries, and the GLP-1 drugs significantly improve their management, which is a plus because seeing patients who have these abscesses under their arms and having them to be drained and drained multiple times wherever their hair grows is really problematic. So to see that adding this to the number of ailments that GLP-1s help with is interesting to observe. Hopefully, none of you have had hidradenitis suppurativa and you don't know what I'm talking about, which is good because it's a condition that is very painful and requires multiple operations and is thought to be related to people who use deodorant. But okay, I guess no comment, so we'll go into the next article. Um, this is an article that says we get so carried away with GLP and its treatment for obesity that we forget about the rest of the patient. And to emphasize that uh, that's just part of the solution to the problem because the GLP-1s also cause muscle loss, sarcopenia, and other conditions that have to be managed at the same time. So we shouldn't get so carried away with GLP-1 that we forgot about the importance of diet and exercise and sleep and all of the other things. Meditation, as Darryl had mentioned. Uh, so that yes, it's an important part of medicine and it helps so many other conditions, but it's not the beginning and an end. It also has its own side effects that we have to be aware of. But it is true that it is affected. It has been positively beneficial for so many other conditions that it's food for thought, from the head to the toe, almost. And this talks about the side effects of some of the GLP-1 drugs, so that you have to be mindful of these. Most of these GLP-1 drugs have only been used for about 5 years, so we really don't know all of the long-term consequences of GLP-1s, but we just know that they're incredibly useful for many conditions. And I guess the sarcopenia is the one, the reduction in body muscle mass is one of the commonest that require you to do exercise and eat protein substances. Any comments, any questions about this? Okay. So keeping in mind that it's a part of the health solution, not the whole health solution. Next article, then let's go to. It's inflammatory bowel disease, which is not very common, but common enough to make a comment on that. It's linked to interstitial lung disease, which is not very common either. But this is something that we're not aware of until recently, that inflammatory bowel disease can lead to pulmonary conditions that seem to be more common in women. When we talk about inflammatory bowel disease, we're talking about ulcerative colitis, regional ileitis. Those are the so-called Crohn's disease are examples of inflammatory bowel disease. Well, let's go to the next article then. Is red meat bad for you? Well, I guess we've talked about ultra-processed foods and so much. The proof is in the processing, and so the more processed they are, the worse off they are for you. As you know, there are vegans and there are better vegetarians and there are meat eaters. So the carcinogens that are present in the pesticides and other things, what makes ultra processed food so bad, and especially the meats, which have things put in them so they don't rot, but they also are not good for your body. And most of the meat that we have is processed and then they emphasize once again that if you want to eat red meat, you're better off doing it at home where it's not processed, um, but pesticides and other things that are used to make the meat not rot and keep alive is something that is unhealthy. This article is pointing out that all meats are not uh, as dangerous as others, depending upon uh, how they are processed is what makes many of them more dangerous than others. While there's much discussion about this, there's very little discussion about the fact that ultra-processed foods are not good for you. Darryl?
Yeah, American meat is worst meat in the world, and that's because compared to like the rest of the world, we okay. Other countries, meat is more likely to be grass fed. Ours is grain fed, which isn't part of their natural diet. Makes them sick, so we load them up with antibiotics. We give them growth hormones. We give them grain that's grown with pesticides, and all of that is in American meat, which you won't find the rest of the world. So, and then the other meat, like seafood, a lot of it's farm raised. Now seafood all over the world is full of plastic, microplastics. So, but you are better off if you're going to eat meat to eat it in other countries than meat that's grown in the United States.
Any other comments? The data supports everything that he's saying. Okay, let's go to the next article. This is it's interesting that lasers are being used so often for all kinds of hair removal and other dermatological issues. But for children, pediatrics, their skin is not as strong as adults, and for that reason, you need to be more careful in approaching pediatric patients with these laser surgery. And lasers can be useful for people of all ages. It's just that in children, their skin is not as mature as adults, and therefore their use in children is can be associated with more scarring than and keloiding, particularly in people of color. So they make this distinction. I think nowadays people use laser for almost any skin condition you can imagine. And the scars that result may be a cause for psychological concern, and is of particularly importance if you're going to do it with children. And since the parents have to give consent becomes important for the parents to understand the significance of what they're doing.
Dr. Callender, what about a laser treats the condition? Is it the heat?
Well, they actually cut out the lesions, but the the laser itself can leave scars that are the problem. There was a time we used cryotherapy and we used steroids for conditions like that, but nowadays we tend to use lasers, which can burn the skin. So
It's the heat of the laser that does the work.
I'm not sure what it is about the laser ablation that damages the skin. I know it's the scarring that results. Uh, One of the things is that I think keloid formation is certainly more common in people of color, and uh, that's where the application of the laser may want to be used, but uh, it isn't always capable of removing the scars. This is an article that talks about one of the most common conditions, chronic conditions that we have, and that is secondary hypertension. And Primary is the one that most of us treat because we don't know a cause, but there are secondary hypertension caused by other conditions, hormonal conditions, pheochromocytoma, Cushing syndrome, hyperaldosteronism, and uh, and even obstructive sleep apnea. Uh, and this talks about how they use two drugs to treat it, and sometimes three drugs. And it varies from some people who want to use diuretics and some don't want to use diuretics, and some want to use clonidine and minoxidil, which have side effects that uh, minoxidil causes a lot of hair. Clonidine uh, interferes often with the ability to have erections. So uh, all of these medications have their own side effects. And so if you have any changes after you start taking these medications, it's important to let the doctor know so they can put you on a medication that isn't associated with side effects. Many people are on two drugs. Um, and this article thinks that spironolactone is one of the drugs that you should add. That's not as often the case. They're only talking about that for resistant hypertension who haven't responded to the first or second drug that you use. But one of the biggest problems with hypertension is the fact that patients don't take their medications as they're supposed to. And I think one of the best things you can do is take your blood pressure twice a day and keep a record of it. And that way you can know when it's high, when it's low, and whether you should let the doctor know about whether you should continue taking it, discontinue taking it, or whatever, and how long. Whenever you discontinue taking it, it's important to continue to monitor the blood pressure so you know, because sometimes after you stop taking the blood pressure, hypertension returns. And if that's untreated, that can then, of course, other secondary conditions. Now,
And how you take your blood pressure is very important. Uh, for example, like you always want to keep the cuff at heart level. You don't want to have the cuff too tight. If you can put two fingers under the cuff, then it's probably about the right tightness. Uh, and when you get your physical, or when you just go in for a checkup if you have hypertension, take your blood pressure cuff into the doctor's office to make sure that it's calibrated to how the doctor is reading your blood pressure.
okay. Also, it's a good idea for you to give yourself at least 10 to 15 minutes peace before you get your blood pressure taken at home or in the doctor's office. And during the administration of the blood pressure, uh, you really should not be talking or doing anything other than keeping still. And more often than not, in the doctor's office, that does not occur. And that's why I like my patients to take their pressure at home as well and bring me a record of their blood pressure so that you can have a better idea. Any other comments about this?
Yeah, one quick question, Charles Davis. Does it make a difference whether you take it in the morning or the evening, what time you take the medicine?
Well, I think you should take it both times, but uh, so you can get an idea of what it is when you wake up in the morning and what it is later on. So you have an idea of, and then of course, there are many studies that suggest that blood pressure medication taken in the evening is very important, even more important than what you take in the morning. So
Mhm.
those are just some additional concerns. But I think keeping a record of it is something that is good for you and for your doctor, so they can get an idea of what your pressures are at home, and then compare and contrast them with what they get in the office.
Yeah. Okay. Is that okay? Hopefully, if I understand it. But I was asking about taking the medicine in the morning or before you go to bed. Is that, yeah.
Well, it depends. Many people, for example, you have medication that lasts for 8 hours, you have medication that lasts for 12 hours, and you have medication that lasts for 24 hours. So it depends upon what kind of prescription your doctor gives you. And you should know whether it's a short term or long term, because if it's a short term, then you would need a second medication. But when they've done studies on when you take the medication, the most effective medications are those that are taken in the evening. That's what many of the studies, recent studies, are showing that. Uh, and then, of course, you have medication that will last for 24 hours. So it all depends on the kind of prescription your doctor's giving you, and whether it's a short term or long term. That would make a difference.
Okay. Thank you. Yeah, it was the last time I was there. The doctor said take the medicine in the evening. I just thought that was interesting.
Yeah, that's the overall. Most of the recent articles suggest that is the best time to take your blood pressure medicine in the evening. Yeah. Because what goes on at night in your dreams, no one knows, and you need to be protected sometimes from your own dreams.
No, from them nightmares.
Yeah, yeah. The older you get, the more of those nightmares you have. This is an interesting article that you have a drug that can cut the malarial incidence in countries where malaria is endemic, which is good to know because malaria still kills many people. And ivermectin is an antiparasitic drug, but the fact that it in Kenya has cut in malaria instances, good to know. Uh, Especially those who travel and go to Africa. Because when you go to those countries, you must take anti-malarial medicine anyway. So it's just an interesting article to let you know that they're still making products in the treatment of malaria, which still is killing people all over the world. Go to the next article. Oh, Darryl?
Yeah, you made that comment that you have more nightmares as you age, and I just pulled up something that said, yes, studies show the rate of recurring nightmares and severe distressing nightmares can increase with age, particularly in individuals over 70. So, a lot of us are over 70, and it says that some of the underlying issues can be health issues, sleep changes like sleep apnea, emotional reactivity, life events, and trauma. But, yeah, nightmares, I could definitely see that raising your blood pressure. And there's been, I think there's a potential for nightmares to trigger heart attacks where people die in their sleep. So, if you have any type of cardiac issues, I definitely see the value of taking the hypertensive medicines in the evening.
Thank you for sharing. Thank you for sharing. Okay, let's go to the next article then. Now, this is an article because I included it because for women, maybe important because they have breast surgeries and other things. But in the decolletage area is the area, the triangular area that runs from the neck and clavicle to in between the breasts. And if you have somebody who wants to use these dermal filters to increase their breast size and other things, this is what they use, dermal fillers. And these uh, become important because these may be a source of the forever chemicals and phthalates and other things that may cause granulomas and other kind of problems. And so you have to be very careful about what you fill your neck and chest with in terms of uh, what kind of fillers they give you when you have breast surgery and you have your breasts uh, treated so that they do a mastectomy. They will often uh, give you what you would call fake breasts. And so you have to be careful about what they put in so that it's not something that will cause you additional trouble. And that's what this article is about. I don't know that too many of us are doing it, but nowadays, getting breast cancer surgery, they will often uh, have a mammoplasty done shortly thereafter, after they take out the breast cancer. And so it's important to be conscious of what they use for your breast filler or your breast replacement. And it's not something that is very common, but people who have breast cancer and have breast cancer surgery, this then becomes important. Breast filler safety, they call it.
Dr. Callender, what is that mammoplasty you mentioned?
Mammoplasty is when they take out your breast and put in another breast, and they put in uh, breast fillers that are kind of like fake breasts, and they have a certain consistency that would make you who are feeling the breasts think that they're regular breast tissue. And so, and the newest thing in breast cancer is to take out the breast and also replace the breast with fillet, uh, breast fillage that is just like you want to feel just like the breast that you took out. So mammoplasty is a kind of replacing the breast you took out with uh, material that feels like it's the real breast, but it's not.
So the concern is the actual material that's being used, right?
Yes, that's correct. Yeah.
I can't imagine uh, anything other than something artificial that would, work. So that would be a big challenge to do something that could last and be safe and not be plastic.
Yes, and that's what this article is all about. And we haven't discussed that too often because we don't have too many breast cancer survivors on this art on this group. But I thought it's something to know because your children and grandchildren, great grandchildren may have to undergo this. Okay, next. Hmm, hmm. I think it was interesting. It's time for us to end because it's 10:30. But this is almost verbatim to what Darryl talked about last week in terms of that diet beats exercise. Because if you decide that you're going to eat a whole lot, then you got to quadruple the time it takes to lose what you ate on. And this is almost exactly what Dow mentioned last week. And this article just points out that John Buchanan.
Now I was going to say the same thing. When I'm finishing swimming, I'm hungry. I want to eat everything.
Yeah, okay. Well, this is the last article. It's 10:30, so thank you for being with us. And any closing comments or questions? Darryl?
Yeah, I had one, and it's back to deodorant, but not exactly. Uh, but let's see. East Asian people, that's Chinese and Koreans, they tend to have less odor due to genetic mutation in the ABCC11 gene that results in lower lipid content and African sweat, making it less prone to bacterial decomposition and odor production. Um, and so the people with the most body odor are Europeans and African descent. So we're kind of related with the stinkiest people on earth, Europeans and African descent. Now we got some musicians on the panel, which is it will be interesting for musicians. This same genetic mutation that makes East Asians have less body odor also gives them dry, flaky earwax phenotype, contrasting with Europeans and Africans have wet earwax, and stronger body odor. So the difference is, like when you have dry, flaky earwax, you have less perception of bass frequencies. So as when you listen to East Asian music, Chinese music, Korean music, it's a lot of cymbals, a lot of bells, high frequency content, as opposed to Africans descent. We love that bass. Gotta have that bass.
Thanks for sharing. Okay. Any other closing comments?